Good morning, good afternoon, good evening, my wonderful and amazing people of God. How on a day? Happy Sunday, happy Sunday. I hope you all are going to church this morning. I just want us to talk about this cerebral palsy because it looks like people are making jest of children now. They take it as part of their cloud chasing, money making Facebook business to make fun of children that actually is not their fault, for the fact that they have this disease that is called a cerebral palsy. So I know there was a lady that came out, and a lot of us didn't even know that MC, one of these comedians on social media, have one of such special children. They are called special children for a reason, because taking care of those children is a blessing. I'm going to put it that way. It's a blessing for anybody that have a special child and takes care of that child, because you put all of your time, all of you in taking care of those one of such children. That is one of the reasons they call them special children. So if you have a child, I just feel that I should educate us a little bit on cerebral palsy, and I'm just going to be calling it CP to abbreviate it. I'll be talking about cerebral palsy this morning, and I'm going to start by making out some factors, starting with the overview of this disease, the symptoms, the movement, and the coordination of this disease, how it affects speech and eating, development, and other symptoms that you could see with cerebral palsy. And when to go see a doctor, go see a doctor immediately when you notice this sign in your child, and what causes it. Actually, what are the causes of cerebral palsy in children, the risk factors that contribute, the mental health, how it affects mental health of the child caregiver and the child care itself, the infant children illness like infants, factors in pregnancy and birth, complication during birth, how it affects, how complications during childbirth could make a child develop this disease, and also how you can prevent this disease. It's a lot, but I'm just going to talk briefly on it, because the more education we have out there on diseases for elderly and children, it will help guide a lot of people's mouth, the utterances, what they come out on social media to say. Because I remember back in the days, a lot of people see older generation with dementia, and they call them witches. In Africa, especially Nigeria, I'm going to speak for what I know in Nigeria, in the villages, they see people, older women with dementia, they say they are witches. And a lot of those women, the people have RIP them, because they are talking of the past, and people start to say they are confessing witchcraft, and in so doing they buy those people. So these are things that the healthcare systems or the healthcare professionals in Nigeria should make as a duty, to talk about these things on televisions, on local news, so that the people will understand these diseases, that it happens. They are not the children, it's not the children's fault, it's not the elderly fault, it's what happens to human beings. Anyway, let's start by discussing briefly its overview, the overview of cerebral palsy in children. A cerebral palsy in children is a group of conditions that affect the movement and posture of a child. If you see this picture that is up there now, you will see how that child is positioned, how he stands. There are some that are on wheelchairs. There are some that are not able to walk, but there are some, it affects children in different stages. So cerebral palsy, as it affects movement and posture of children, it also occurs Cerebral palsy occurs due to damage to the developing brain of a child that is still in the mother's womb. This disease occurs due to damages to the developing brain that mostly occurs before the child is birthed, before the child is born. So it is something that both the child and the woman have no control of. So it happens due to, maybe I'm going to get to that, stroke. Maybe the mother is having a stroke, or the child itself is having a stroke while the baby is in the uterus. So many things can lead to that, lack of oxygenation and so on and so forth. So the symptoms, I said I'm going to take it bit by bit and talk about just a bit by bit, because I don't want the video to be too long. The symptoms. Symptoms can appear during infancy or preschool years. It could be mild or very serious. It could be very serious. Affected children's symptoms may range from reflexes to stiffness in their muscles, irregular posture, like the one we see on the video right there, irregular posture where the movement are not able to be controlled. And when you have a child like this, seek for help. If you are able, get therapy for that child. Children with this condition might have reduced range of motion, that is, moving their hands up and down, and their joints, their legs, due to muscle stiffness. Like I said earlier, this is where you need therapy immediately. Yes, the baby needs therapy immediately when you have those stiff muscles, and you need therapy immediately. Some of these people, children, cerebral palsy, may have intellectual disabilities, epilepsy, blindness, deafness, while others will not. They have different symptoms and different things that affect children with cerebral palsy. That is why when you have any of these diseases, try to read about them, try to study them, so that you will know how to go about getting treatment for the people that are affected. There's no cure, but treatment can improve the functions of the children, of the people with cerebral palsy. And it's not, I don't know why they call them the name they call them. I'm not going to use that name that lady was using to call MC Bakare's child. I'm not going to do that, because I don't know why people derive pressure in bringing children on social media to talk down on children, that the diseases that these children have is no fault of theirs. So the symptoms of cerebral palsy may be different from child to child during the child's development. We talked about the movement and the coordination, the stiffness and the reflex, the movement. We talked about the therapy and the floppiness, the reasons they constantly need therapy. I talked about that, lack of balance of muscle coordination, uncontrolled movement. Some people have this uncontrolled movement. Some children, it depends on how the muzzle is, willing to go that day or that time. So you need therapy for children with CP, with cerebral palsy. Trouble walking. You have children with this disease with CP, they have trouble walking on their toes, or movement, or coordinating. These deficiencies in them needs, I call it deficiency, I call it challenge. Like I stated earlier, that's why they are called special need children. So it's not a cause or fault of theirs. They are special need children, because you have to pay attention and give extra care to these children. So they need therapy. These children need therapy. This is where the Nigeria healthcare system comes in. I always say it. They need to give children free healthcare and the elderly. Maybe with that, and the healthcare people in Nigeria, professionals will teach people about these diseases, so they don't come on social media and begin to rant about things they really don't know. It also affects speech and eating. Delay in speech development, trouble speaking. You have some children that normally they will not talk, they will not speak. So a child with cerebral palsy, this also affects them greatly. They have trouble in speech development, in pronouncing words, in calling out words, trouble speaking, trouble chewing and eating. That's why most of the time you have to feed them, you have to, help them to eat, because the muscles, especially when the muscles are controlled, they are not able to hold on to spoons, the ones that are grown to feed themselves. So they need special treatment and special care. That's why, like I said, they call them special children. So you see, and sometimes you see some of them have drooling or trouble swallowing. The drooling, you see saliva like it's just drooling from their mouth and all that. That's why they are called special children, because you have to provide extra care to these children. These are all and many other factors associated with children or people with cerebral palsy. So the development also, like I stated, the delay in development like motor skills, such as, when pikin no crawl on time, sitting and, standing up, their growth is delayed. Let me just put it that way. Their growth is delayed. Learning disability is delayed. Everything is slow. And of course, intellectual disability delay because of the damage to the brain. Remember, what is causing this cerebral palsy is damage to the brain. Sometimes it's lack of oxygen to the brain at the time of development. Other neurological symptoms like seizures, epilepsy, hearing, vision, trouble feeling pain, and so on and so forth. Even bladder and bowel issues, incontinence of bowel and bladder. That's why you find out that these children sometimes they use diaper for a very long time, breathe for a very long time, because they are special need children. They need care. And also, when you notice all these symptoms, please go see your child doctor immediately. Don't wait, don't delay. And the causes, I'm trying to rush because I don't want this video to be too long, like I said earlier. The causes of this cerebral palsy in children, of course, is an irregular brain development or damage to a developing brain of the fetus. When the baby is in the womb, it's called fetus. That's when it happens, the irregular damage development of the brain. All this usually happen before a child is born, like I stated earlier. Many factors that can lead to change in a brain development, like gene changes that result in genetic conditions and difference in brain development, mental, maternal infection, like the mother carry infection, she has infection that affects the unborn baby, like stroke. I talked about the stroke earlier, which interrupts blood supply to the developing brain. When that happens, the child will develop CP, bleeding into the neonate brain from the womb. It's uncontrollable because you don't see the child, don't see it, except you go for tests and treatment and you go for your regular checks, bleeding into I said that, into the brain and the womb, infant infection that cause swelling in or around the brain. There are so many other diseases that can cause that. In fact, that can cause the swelling around and within the brain, like meningitis, traumatic head injury to infant, like motor vehicle accident. When there's an accident, the child fall, usually hit his head. Physical trauma, that will affect a young child brain, can cause cerebral palsy as well. That's why they encourage, when a child is riding a bike, you always give wear them the helmet. Watch children when they fall, because their brain is still developing. I talked about that. In fact, I cannot stop emphasize more on that. Oxygenation, that's the lack of oxygen to the brain related, due to labor. Sometimes women stay during labor, they stay for a longer time, so there's no oxygen to the brain of the child. So that also could contribute to a child having CP, cerebral palsy. The mental health aspect is certain infection or toxic exposure, like toxic exposures during pregnancy can significantly increase cerebral palsy as well. Risks to neonate, like inflammation that will trigger infection, fevers that can damage the unborn baby's developing brain. So these are many other things, many other factors, that will affect a child, that will cause a child to have this CP disease, like the viruses, like I talked about, the infection, this cytomegalovirus. These symptoms, the mother are the ones that get this symptoms. They are like flu, the regular cold infection, flus like symptoms. The mother needs to get treatment immediately or get vaccinated. The German and measles, get vaccinated. If you know you're getting pregnant, or you know, need to check yourself. Herpes, syphilis is a bacterial infection from, you know, sexual transmission or sexual contact. Toxoplasmosis, you know, from contaminated food, soil, and so on and so forth. All these are things like Zika virus. Zika virus infection is spread by the mosquito. You know, it is spread by mosquitoes. So that Zika virus is common in Africa, and this can make the child to have a cerebral palsy as well, because it can affect the brain from developing, the development of the brain of the neonate, of the unborn child. You know, exposures to toxins, I said that earlier. Mother's condition like preeclampsia, seizures, even thyroid condition. When you have thyroid condition, can cause a child to have cerebral palsy. You know, Mercy Josie talked about how she had thyroid, scared, and she thought she had cancer, but thank God she did not, you know. So these are the reason why you should always go for checkup. After the child is born, if that infant have some illnesses like bacterial meningitis and a viral encephalitis, you know, those are swelling around the brain, you know, and untreated jaundice, when you have yellowness of the eye and of the skin. So these are the things the mothers should know to make sure they take these children, their children, to the hospital. Bleeding into the brain, you can see that I talked about that also. So these are the reasons why people should make sure they go for treatment. Prevention, you can only make sure that before you get pregnant or during your pregnancy. Yes, prevention is very important, you know. During your pregnancy or before before you get pregnant, especially when you know that you want to have children, try taking your all your vitamins, your folic acid, your prenatals, you know, and all that. Make sure you get vaccinated, especially when you know that you have any kind of viral infection or bacterial infection. Get treated. Take care of yourself. Seek early and continuous prenatal care. Avoid substance abuse, because according to research, they say that, you know, that alcohol, tobacco, and all these illicit drugs, substance abuse, you know, will, you know, make pregnant women, if they continue that behavior, we make pregnant women to have children with cerebral palsy. All these are linked to cerebral palsy, CP. So always prevent the head injury for all children, whether your children or not your children, especially when they are young. It is very paramount that we prevent children's head, especially when they ride a bike. Get them the helmet to prevent their. And so about this MC Bakari's daughter that people are just talking about on social media, that she has cerebral palsy, it's not the child's fault. So people should stop talking about you don't bring things like that to social media, and you don't expect him to bring his child with CP to social media. So I don't know where this narrative or where this trend came up from, and people said this girl started making video of this young man and his family. So my people, please share this video so that a lot of some ignorant people out there will learn about some diseases that children have that is not, you know, it's not their making. So please, thank you, and leave your constructive comment. And of course, I always want to listen and hear what you think, and your constructive comments regarding this cerebral palsy in young children. Thank you, and God bless. Bye.